PN 4006 Final Exam Test Bank 2 Newest 2026-2027 Actual Exam with complete questions and correct detailed answers. Question 1. PG1. PN 4006 Final Exam Test Bank 2 Newest 2026-2027 Actual Exam with complete questions and correct detailed answers, verified answers, already graded A+. A patient's abdominal surgical wound has dehisced. What is the priority? Nursing action. Apply a dry sterile dressing. Apply a moist sterile dressing. Notify the physician and leave the wound uncovered. Pack the wound with dry gauze. Apply a moist sterile dressing. Question 2. Which of the following statements about the SA node is correct? It controls voluntary contractions of the heart. It is responsible for blood circulation. It is known as the pacemaker of the heart. It prevents electrical impulses from reaching the ventricles. The sinoatrial SA node is called the pacemaker of the heart because it initiates electrical impulses for heartbeats. Question 3. PG2. A patient's ECG shows an abnormal result. What should the nurse do? First, call the physician immediately. Administer oxygen. Assess the patient. Prepare for defibrillation. Assess the patient. Question 4. A patient taking furosemide, Lasix, for heart failure has 3+ edema in the lower extremities. What should the nurse assess to evaluate medication? Effectiveness, skin turgor, daily weight, edema levels, capillary refill. Edema levels. Question 5. Which vitamin is essential for calcium absorption? Vitamin A, vitamin C, vitamin D, vitamin K. Vitamin D. Question 6. PG3. Which diagnostic test is most appropriate for evaluating muscle weakness and detecting neuromuscular disorders such as muscular dystrophy? Magnetic resonance imaging, MRI, electromyography, EMG, computed tomography, CT, scan, bone density scan. Electromyography, EMG. Question 7. A nurse is caring for a patient with a hemovac drain. What is the correct method for ensuring proper function? Keep the hemovac fully expanded. Compress the hemovac to a flat surface before closing the cap. Flush the hemovac with sterile saline before emptying. Leave the cap open to allow air circulation. Compress the hemovac to a flat surface before closing the cap. Question 8. A nurse is monitoring a patient after surgery. When is the patient at the highest risk for hemorrhage? 48 hours after surgery, 24 hours after surgery, 72 hours after surgery, 7 days after surgery, 24 hours after surgery. Question 9. PG4. A nurse is educating a patient on wound care with STRI strips. Which statement by the patient indicates a need for further teaching? I should let the STRI strips fall off naturally. I should apply moisture to the wound to help it heal. I should avoid pulling the STRI strips off prematurely. I should keep the wound clean and dry unless instructed otherwise. I should apply moisture to the wound to help it heal. Question 10. STRI strips should be kept dry unless directed otherwise. Excessive moisture can cause them to loosen prematurely, affecting wound healing. A patient with severe diarrhea is at risk for which of the following complications? Hyperkalemia and hypernatremia, electrolyte and fluid loss, increased blood glucose levels, metabolic alkalosis. Electrolyte and fluid loss.